Cancer pain can be acute or chronic and is one of the most feared symptoms for patients. It significantly affects quality of life. Causes of cancer: pain, direct tumor invasion into bone, nerves, or organs, treatment-related surgery, chemotherapy, radiation, infection or inflammation due to immunosuppression, phantom pain after amputations like mastectomy, types of pain, somatic localized, such as bone metastasis, visceral deep, dull pain from organs, neuropathic burning shooting from nerve compression or chemotherapy induced, nursing assessment of pain, location, duration, intensity, using a 0 to 10 scale, provoking and relieving factors, impact on function and sleep, patients' cultural, emotional, and spiritual beliefs about pain, pain management interventions, pharmacologic opioids like morphine and hydromorphone, NSAIDs, acetaminophen, adjuvants, antidepressants, anticonvulsants for neuropathic pain, non-pharmacologic, relaxation, guided imagery, massage, heat or cold, acupuncture, spiritual support. NCLEX. Tip: always believe the patient's report of pain. Reassess pain regularly after interventions. Surgical treatment can be curative, diagnostic, preventative, or palliative. Types of surgery: curative removes entire tumor if localized. Prophylactic removes tissue at high risk, for example, BRCA positive mastectomy. Palliative relieves symptoms like a tumor causing obstruction or pain. Reconstructive restores function or appearance, such as breast reconstruction. Nursing care after surgery. Monitor for infection, bleeding, and deep vein thrombosis. Pain control, emotional support, and body image counseling. Promote early mobilization and deep breathing. Chemotherapy uses cytotoxic drugs to kill rapidly dividing cells. It's systemic and affects both cancerous and healthy cells. Common side effects: system affected. Side effects: GI system, nausea, vomiting, anorexia, mucositis, hematologic, anemia, neutropenia, thrombocytopenia, integumentary, alopecia, reproductive, infertility, sexual dysfunction, neurotoxicity, peripheral neuropathy. Nursing care for chemotherapy. Patients: neutropenic precautions, hand hygiene, no fresh flowers or uncooked foods. Monitor ANC with less than 1,000 indicating neutropenia. Bleeding precautions for thrombocytopenia. Administer antiemetics before chemo. Encourage small, frequent meals. Use PPE when handling chemo drugs or bodily fluids for 48 hours after. NCLEX. Tip: use central lines for vesicant drugs to avoid extravasation. Radiation uses high-energy beams to destroy cancer cells. Can be external, known as teletherapy, or internal, called brachytherapy. Common side effects: skin, dryness, erythema, desquamation, fatigue. Area-specific effects: head and neck, mucositis, xerostomia, abdomen, diarrhea, nausea, pelvis, cystitis, infertility. Nursing care after radiation: protect skin from sun, heat, and friction. Avoid lotions unless prescribed. For brachytherapy: time, limit exposure, distance 6 feet, shielding, lead apron, private room, restricted visitors, no pregnant caregivers. NCLEX. Tip: if a sealed implant dislodges, use long-handled forceps and place it in a lead container. Used to treat hematologic cancers like leukemia, lymphoma, and multiple myeloma. Types: autologous patients' own cells are used. Allogeneic, donor stem cells, either related or unrelated. Syngeneic, identical twin donor. Process: first, high-dose chemo or radiation to destroy the bone marrow, then stem cell infusion. Finally, engraftment, which occurs 10 to 20 days later. Complications, graft versus host disease, or GVHD, which is an immune attack on the skin, gastrointestinal tract, and liver. Infection, due to neutropenia. Bleeding, due to thrombocytopenia. Nursing interventions, strict infection and bleeding precautions. Monitor labs such as white blood cells, platelets, and liver enzymes. Administer immunosuppressants like cyclosporin for GVHD. Provide nutritional and emotional support. Next up in Part 3, we'll go deep into the hematologic cancers and their nursing assessments and interventions, skin cancer, leukemia, lymphomas, including Hodgkin's, multiple myeloma, and testicular cancer. Types: basal cell carcinoma, the most common, slow-growing, and rarely metastasizes. Squamous cell carcinoma can metastasize and appears as scaly red patches. Melanoma, the deadliest form, arising from melanocytes. Assessment: use the ABCDE rule. A for asymmetry, B for border irregularity, C for color variation, D for diameter greater than 6 millimeters, and E for evolving lesion. Interventions: surgical excision, cryotherapy, and topical chemotherapy. Radiation or immunotherapy for melanoma. Patient teaching should include self-skin exams, sun protection, and avoiding tanning beds. Leukemia is a group of cancers of the bone marrow and blood leading to the overproduction of immature white blood cells. Types: acute lymphocytic leukemia, or ALL, is most common in children. Acute myeloid leukemia, or AML, affects adults. Chronic lymphocytic leukemia, or CLL, occurs in older adults. Chronic myeloid leukemia, or CML, may have the Philadelphia chromosome. Assessment: symptoms include fatigue, fever, and frequent infections. Also look for bleeding, bruising, pallor, bone pain, weight loss, and enlarged lymph nodes and spleen. Interventions: treatment options include chemotherapy and radiation. Bone marrow or stem cell transplant may be necessary. Infection control measures, such as reverse isolation, are crucial. Implement bleeding precautions and provide transfusions as needed. Offer nutritional and psychosocial support. Cancer of the lymphatic system. Hodgkin's disease is characterized by Reed-Sternberg cells and usually affects young adults or the elderly. Assessment includes painless enlarged lymph nodes, night sweats, weight loss, fever, fatigue, anemia, and pruritus. Interventions involve chemotherapy, specifically the ABVD regimen, and radiation. It's important to monitor for neutropenia and infection, and to teach energy conservation and nutrition. Non-Hodgkin's lymphoma is more common than Hodgkin's and does not have Reed-Sternberg cells. It is often disseminated at diagnosis. Assessment and intervention are similar to Hodgkin's, but more aggressive forms may need intensive chemotherapy. Monitoring for tumor C lysis syndrome is crucial, as well as providing psychosocial support. Multiple myeloma is a cancer of plasma cells in the bone marrow, leading to the overproduction of non-functional antibodies. Assessment includes bone pain, especially in the spine and ribs, hypercalcemia, pathological fractures, anemia, renal dysfunction, and recurrent infections. Interventions consist of chemotherapy and steroids, bisphosphonates to manage bone loss, encouraging fluids to prevent kidney injury, pain management, fall prevention, and monitoring renal function and calcium levels. Testicular cancer is the most common cancer in young men, ages 15 to 35, and is often curable if detected early. Assessment involves a painless testicular lump, swelling, or heaviness in the scrotum, and back or abdominal pain if metastasized. Interventions include orchiectomy, which is the removal of the testicle, and radiation or chemotherapy for advanced cases. Teaching about monthly testicular self-exams and addressing fertility concerns, such as sperm banking, are also important